Well, number one is that most men will have bladder irritation for a few weeks to months afterward, and that can be a little bit of a nuisance. So being prepared as to how they're going to handle that. Number one, who do you call? Because sometimes men want advice medically on how to deal with that at various levels. And I often will also give them some idea of the sorts of advice they may get if they do call, so it's nice to know that. And the advice they'll get in terms of who to call will vary as to where they are. You know, obviously if somebody lives in another community far, far away, it may not be me, but it could be. Phone's a wonderful thing. And also there are some lifestyle things to think about. So, for example, if people do a lot of business travel, you know, if they can suspend that around the time when the bladder symptoms may be most annoying until they recover, that's nice. Sometimes that's not an option. If they must travel, if they can't afford business class, that's nice because there isn't the long wait for the bathroom. Things like that. Planning when they're going to take vacation trips and things like that. And sometimes people will schedule their brachytherapy procedure around activities like that. The second thing about recovering from the brachytherapy is just to know what the routine is in terms of checkups afterward, and I suppose that's true with any treatment for prostate cancer. Know more or less how the appointments are scheduled usually, and what they involve, and basically also letting them know there's some flexibility around that if they're otherwise we're planning to be away around the time we'd be seeing them. I mean, obviously we can work the appointments around their lives rather than the other way around. In terms of the recovery phase, knowing who does what. I mean, knowing that we don't completely take over from the urologist, for example. We work with them. So if there are bladder issues afterward for which some advice may be helpful, we do draw on the advice of the urologist ourselves as well. So letting know that he or she remains on the team is important for them to know. Knowing that we are open to discussing personal issues, things like incontinence, which can be a little embarrassing, and also sexual functioning issues. I mean, a lot of men are quite private and aren't used to people asking. And obviously you have to be respectful of people's sensitivities around that, but basically making sure they know the door is open and that they will gently be asked, and mostly people kind of get used to it and then just tell us without my having to say anything, and that's great because then we can kind of address any concerns that they may have. And then I guess the other thing about the recovery phase is, quotes, they will get through it, end of quotes, because some men have this tremendous fear that it's just going to be dreadful forever, and you know, for most men it isn't. I mean, this too shall pass, so knowing that is important going in.